This paper is looking at enduring outcomes of COVID-19 work absences on the US labor market. So what these authors are doing is they're doing a couple things. First, they're looking at before the pandemic, during the pandemic, and post-pandemic on work absences and the effect of this increasing in COVID infections throughout the population to see how that impacts work absences. And then they're also looking at things like influenza and RSV and taking that stuff out of the data so that they can really say that these are primarily due to COVID infections that are causing these absences. Now, they're predominantly using wastewater viral activity levels to do this assessment, but they're also using case-based data for like prior to this and hospitalization data for prior to when we really started using wastewater data in mass at the start of 2021. Now, the first thing they found is that compared to pre-pandemic, the post-pandemic health-related absences were 12.9% higher. This equates to about 140,000 additional monthly absences. They also found a deviation where people that have low exposure, so like work from home, had less of a chance to have these health-related absences than people that were forced to work in person. So having high exposure, these people were at a much greater instance of getting these health-related absences. So here's our first plot of the data to sort of explain all this. So the black line here is going to be excess health-related absences. The blue line is going to be COVID wastewater surveillance. So we started having COVID wastewater surveillance at around like the end of 2021, but in mass, we had it for COVID around 2022 when we really started having data. So we have this like very large spike here where it's starting, and then we have data from then on to 2025. That's where this study goes to, is to the start of 2025. And we see that there is the viral activity level increases are charting with the increases in health-related absences, which shows the correlation between COVID illness and then missing work. And we see that there's very high levels of increase in these work-related absences, the black lines, during the pandemic. And then after the end of the public health emergency, these lower. So you can see like the trend here is sort of a downwards facing arrow like this. But it's also going to be sustained at a certain level here. So while the wastewater is still surging, we're having less people calling out sick from work. This could be because we no longer, with the end of the public health emergency, we no longer have that mandated coverage for people missing work. So this is most likely a sociological thing because we're still having people getting sick en masse in this 2023 to 2025 period, but less people are taking off sick for work. So that means that people are going into work sick. And we all know this from our coughing colleagues that are pretending, oh, I have allergies when they really are actively sick. So this is showing that, but we're still having a sustained increase, even with this sociological factor of people going into work sick. It's still at a sustained higher level than before the pandemic, which is showing that there's a sustained impact on people taking off work, which is going to have an economic impact on just jobs in general. And then in general, they have plotted here the COVID-19 wastewater activity level that the NWSS program provides, and then health-related absences. And you see it's sort of like a logarithmic fit. They used a linear fit here, but it's sort of looking more like a logarithmic regression. So more something like this and like that. But what it's showing is that as the viral activity level increases, so there's more COVID circulating in the wastewater, it also means that there's going to be more health-related absences with this increase in infection throughout the community. But of note, the viral activity score, how it's measured, has changed. So it's no longer comparable to these past values, and it's unclear if these types of fits still hold. And then the plots here are pretty interesting. So the one on the left is essentially, it's called suitability for work from home, but it's essentially looking at remote work versus in-person work. And then they're looking at physical proximity to others. And that's another like correlation between like remote type work and then like in-person style work and like how close you are around other people. So when we're looking at this, we're going to be comparing time periods. So like this one to this one to that one, and then this one to this one, just for reference. So if we look at each and every single one, there is an increase of this dark blue, which is low suitability for work from home. So that means in-person work. And then high suitability for work from home means remote work. So the remote work people are having less health-related absences than the in-person people, which makes sense because they're not going to be interacting with colleagues that are going in sick. And then similarly for physical proximity, we're looking at these correlations right here. That's how it's set up. You can tell from the dates down there. And if I delete that real quick, so we're seeing increases in each one, which again is showing that the more physical proximity you have to others, the more likely you are to get sick, which is why, like, even though it's semi-arbitrary for that 6-foot rule, it's still important to like keep your distance from others when you're in person to the best of your abilities. And then if we look at this table for pre-pandemic, pandemic, and then post the end of the public health emergency declaration, and we look down here to educational attainment, we see that when we have higher, so first, the higher the numbers are, that means the higher the number of work-related absences for each level. So if we look at people that have college or a college graduate, or have more than college, so like a master's PhD, we see much lower numbers versus people that have some college, high school, and less than high school, where they have much higher numbers. So this is showing us sort of that the people with less college or educational attainment would probably, if you're doing little Venn diagrams, are going to be more likely the people that have to be in person versus people that would be able to work remotely versus like the college and more college. So I think this is sort of like a subsect analysis of what we were seeing earlier for remote and in-person work. And then something I found to be very interesting in their supplemental data is that for the health-related absences per 1,000 workers for influenza A viral activity levels, it did not correlate. So the increasing levels of viral activity for influenza A did not correlate with health-related absences, meaning it's a poor indicator for that. And it actually almost seems to negatively go with it. But because of this one data point out here, it is a flat line. But this is sort of concerning that this is such a poor indicator for that. And then also for RSV, we're seeing the same thing. Where we have no correlation with increasing levels and health-related absences, which could indicate that this might not be the best measure for COVID as well. The viral activity score is sort of a measure that was developed by the CDC to compensate for the fact that every wastewater facility is doing something a little different, using different analysis methods, collection methods, using flow calculations or normalization methodologies. We started with BioBot Analytics. There was one prior to that, but then BioBot Analytics really took it over, and then now Verily took over from that. That's working with wastewater scan to essentially do that data. So all these different methodologies have come in. So to compensate for everything being different, they try to normalize it against this past data to create this viral activity level score. I've covered this before on my YouTube channel. You can check it out there. But because of the standardization attempt, it might be sort of hiding what's actually happening. And then also because it like normalizes versus the past year, it's making it, instead of having like absolute levels, like once we hit this level, we know this is happening. It might make it seem like things are not as bad as they actually are, which is what I suspect we're seeing at times here in our current day and age in 2026. Finally, not only did they look at health-related absences, they also looked at exits due to that absence from the job force, so getting sick enough to have to leave your job position. So we'll see we have our baseline pre-pandemic. During the pandemic, this increases, and then after the end of our public health emergency declaration, it's still at high levels, sustained high levels, which is showing that people are still exiting the workforce from these illnesses, from the COVID infection. And this is after taking out the influenza and the RSV data. And this is an all year round disease, which is having a similar burden to influenza. Like influenza is very intense for about 3 months. But after that, it's at very low levels, for example. But COVID is all year round. So it's having equal or greater burden to those 3 months of influenza, oftentimes greater, which makes it more impactful at the large scale and why we need to continue doing things to try and prevent these illnesses. If you like this type of content, please follow me on Patreon at Patrick the Biostemist. Have a good one.